afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Friday, June 5th. We are joined today by Minister of Community Services John Streicker and Yukon's Chief Medical Officer of Health Dr. Brendan Hanley. We also have with us Mary Thiessen, our American Sign Language translator, and André Boursier from the French Language Services Directorate, who will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Thank you. Minister Streicker?
Thanks, Pat. Hi, Yukon. Thank you for being here today and joining us. As I begin, I would like to start with some thank yous. Today, I wanted to acknowledge our community leaders, municipalities, First Nations, local advisory councils, local chambers, not-for-profits, recreation associations. Thanks to all of the people who are helping to navigate COVID-19 in all of our communities. I wanted to provide a brief update on some of our government's actions in response to COVID-19. The first has to do with enforcement. I know there are concerns in the Yukon about people traveling through our territory on their way home or to work, whether that is in Alaska, the Northwest Territories, or British Columbia. I want to remind us all Yukoners, that we have the Civil Emergency Measures Act enforcement officers stationed at Yukon's southern border, at our airport, and in our communities throughout the territory. We also have a roadside information station in Whitehorse, just south of Robert Service Way, to ensure travelers in transit through the Yukon understand their required route through the territory and the restrictions in place under the Civil Emergency Measures Act, or CEMA. Regarding our border with Alaska, we are working closely with the Canadian Border Services Agency to ensure travelers coming into the territory are aware of the restrictions in place here in the Yukon. That is true whether those arriving at our border are coming to provide an essential service or are in transit to the lower 48. We recently created new information maps for the southbound routes from Beaver Creek. These are available on yukon.ca and have been shared with the Canadian Border Services Agency to provide to travelers. We need to keep in mind that the Alaska Highway is a major transportation link connecting the continental United States to Alaska. Many people are on their way home to Alaska or to work in critical and essential roles there. We know that there are a lot of vehicles with outside license plates in our territory. Sometimes they are here for essential services. Sometimes they are in transit, and sometimes they are not where they should be. If you have concerns about individuals that may be violating restrictions, rather than attempt to address the situation yourself, I strongly encourage you to contact the COVID-19 call center at 1-877-374-0425 or to email covid19enforcement@gov.yk.ca. We have enforcement officers in Carmacks, in Mayo, Dawson, Ross River, Faro, Haines Junction, Old Crow, Teslin, and Watson Lake. And RCMP remain available to support enforcement in all communities. I want to encourage all Yukoners to please be respectful of those who are transiting through our territory and those who are coming from outside to provide critical and essential services. We all have a role to play when it comes to following the public health orders and recommendations that are in place. Being respectful to someone you are worried may be violating orders, being disrespectful to someone you are worried may be violating orders is not one of those recommendations, and clearly not something we can or should condone. The Yukon has long been known for our hospitality, community-mindedness, and beauty. Let's not allow the current situation to change that. Again, if you have concerns, please contact our enforcement team so we can follow up appropriately. I want to particularly thank the enforcement officers stationed on the front lines and throughout the territory who are doing a fantastic job of providing information to Yukoners and travelers during the current emergency. Next, I want to touch on our critical and essential workers. The Government of Yukon's guidelines for critical and essential workers has been updated this week to provide greater clarity to workers delivering critical and essential services in the territory between now and July 1st, 2020. The updated guideline document clarifies that the restrictions of gatherings to 10 people does not apply to workplaces, that people who need to do urgent repairs or maintenance on critical infrastructure are considered critical workers, as are judges, witnesses, and other individuals necessary to carry out the rule of law. The updated document also clarifies that all of Yukon's communities, whether Whitehorse or rural, should be treated similarly by people who need to come to the Yukon to work from outside the territory. The guideline document is in effect immediately and applies to the current phase of our approach to the pandemic. Further changes to this document may arise once we enter Phase 2 of our plan to lift COVID-19 restrictions. We anticipate that provided we maintain the current good course we are on as a territory, that after July 1st, 2020, the directions and guidelines will be expanded for critical and essential workers entering the Yukon from BC. The updated guidelines can now be found online at yukon.ca. Now I'd like to touch on a few issues related to mental health. Excuse me. Now I'd like to touch on a few issues related to mental health in our territory, which I know Dr. Hanley will speak about as well. As of today, guidelines are now available for faith-based organizations in the territory. This is good news for Yukoners during these uncertain times. I know that the current situation has created a lot of stress for individuals and families in our territory, and that many turn to their place of worship to find support or guidance. I'm pleased to share that beginning this Sunday, June 7th, places of worship will be permitted to open. Service organizers and attendees are required to adopt steps to ensure physical distancing, even adapting the nature of their services where necessary. This means, for example, that the seating capacity of indoor venues will be limited to 1/3 of the building capacity up to a maximum of 50 people, including service leaders and organizers. Leaders and organizers must also increase the frequency of cleaning and disinfecting common high-touch areas such as seating, railings, switched and ceremonial objects. Organizers are required to complete an operational plan that must be produced if requested. It does not need to be approved in advance. The guidance for faith-based services and activities is now online at yukon.ca. Another area of life that is important to the mental health of many Yukoners is sport and recreation. This week we posted guidelines for sport and recreation activities in the territory. We want to encourage sports and recreation organizing to restart non-contact activities in a safe and responsible manner because we know how important these activities are to Yukoners. Sports and rec organizations that employ staff, for example, coaches or referees or coordinators, need to create an operational plan that is available upon request. Sporting events, for example, tournaments, meets, races, need to submit an operational plan for review whether or not they employ staff. Social, recreation, or competitive sporting teams, groups, and activities that operate without paid staff do not need to create an operational plan, but they might find it useful to work through a plan as they assess their activities in any case. Operational plan templates can be found online at yukon.ca. Also today, we announced the recipients of the Celebration of Sport Excellence Awards for 2019. These awards were presented to over 50 athletes and 2 teams across 14 different sports. It's always an honor to celebrate the accomplishments of our Yukon athletes. The achievement of our Yukon athletes and coaches in 2019 speak to the strength and abilities of our territorial sport community, our athletes, coaches, trainers, families, organizers, volunteers, and fans. Even though COVID-19 has been challenging for athletes, teams, and games, I'm inspired by the fact that many of our Yukon athletes are continuing to train, work towards their personal bests, and look forward to the time when they can once again compete in regional, national, and international competitions. Finally, I know that this time of year, Yukoners are eager to get outside and enjoy our beautiful territory. Getting out on the land and experiencing nature is one of the best ways to relieve stress, stay active, and get away from the information overload that we all face on a daily basis. The territory's parks and campgrounds opened for the season yesterday, and I know that many are already at or on their way to their favorite spot. I passed a lot of you at the Marsh Lake campground coming into town yesterday. If you are camping this weekend or any weekend, please be diligent in practicing the Safe 6, physical distancing, regular hand washing, staying home when sick, not gathering in groups of more than 10, limiting travel to communities, and self-isolating when required. Number 1, stay 2 meters apart from people not in your household bubble. Wash your hands and clean and sanitize the surfaces you come into contact with, like picnic tables and common areas. 3, if you're feeling sick, please stay at home. 4, self-isolate when required. 5, limit gatherings to 10 or less. And 6, be as self-contained as possible to minimize the impact to our communities. For example, you can pre-purchase your camping permit online. I remember the campsite rule growing up: to leave the campsite better than how you find it. I think that should apply to how we treat our communities as well, and how we treat each other. I'm on calls with community leaders a half dozen times a week, and I know many folks are ready to welcome Yukoners back into their community. But many others are anxious about the influx of visitors. Please be respectful out there. Communities are deciding what works best for them, and we need to be mindful of that. Please be respectful when traveling through Yukon communities and follow the campsite rule. I appreciate how hard Yukoners are working to keep our territory safe, and I thank everyone for that.
Thank you, Minister Streicker, and good afternoon, Bon après-midi. Friday afternoon, the sun is out, campgrounds are opened. One could easily be tempted to forget about this whole COVID thing and just have a normal Yukon summer weekend. It is wearing on all of us, a feeling of being confined, whether from the threat of COVID itself, the need to physically distance, face the lineups and restrictions at the stores, or from feeling that the borders are closed and we must stay close to home. The office building next to here where I'm working currently gets pretty hot during the day, and with the doors wide open to provide a breeze, a small sparrow became trapped inside my office earlier this week. The bird had lots of space to fly around and probably enough crumbs to keep it going, but being confined in an unfamiliar space, it was clear that as we worked on ways to release it, we were only driving it further into small spaces where it could hide from us and feel safe. I think that is maybe how many of us are beginning to feel these days, feeling cooped up, anxious, nervous as a result of the uncertainty for the future this pandemic has put on all of us, and seeking further refuge sometimes in familiar places. Lucky for us that for many of us, those familiar places include the outdoors, whether on the deck or in campgrounds or on the trails. And I'm once more so grateful that we live in this beautiful and privileged part of the world. Like it or not, COVID is part of our world and will be for perhaps years to come. As we move slowly through our reopening phases, we juggle with that careful balance of managing COVID risk versus the risk of being shut down, whether from border closures, closures of commerce, closures of our social needs, or closure to many of the other facets of life that we want and need to access. And all of this is stressful. I again want to spend a few moments, like Minister Streicker pointed out, talking about mental health. Everyone's mental health. The pandemic is affecting all of us, but each of us is affected in a unique way. Even those who normally feel immune or invulnerable to life stresses are struggling. I hear, as do you, the stories and questions every day from friends, from colleagues, and from strangers. Some are overwhelmed, some are frightened, some are angry. Some don't know quite what they're feeling, except that things are not right. Like the bird, many of us are looking for spaces where we can hide and feel safe. No matter how much we prepare, pandemics are always unexpected, and this one has not been an exception. It is causing unsettling situations and a sense of loss of control. It's normal for people to feel sad, stressed, confused, scared, or worried. People react in different ways, and that's normal too. When faced with ongoing traumatic situations, like a pandemic, and everything that comes with it, people may find themselves struggling to control their thoughts and mood. Some people who have a lot of stress in their lives already might have an even harder time managing this stress, the worry, and the lack of hope that can be very real in the face of this pandemic. Parents are experiencing increased stress working from home while struggling to meet the needs of their children. People working from home are experiencing increased stress with the lack of routine, the lack of separation between work and home. Most work environments have changed in one way or another, some drastically, and many have lost their chance for work or a realistic income. Families are struggling without the routine that school and regular activities offer. Uncertainty is also a strong theme. People are facing uncertainty in the face of family separation, job losses, financial downturn, and a lack of relied-upon service, causing anxiety, depression, and even existential concerns. People are separated from their families and loved ones, especially if they live in other parts of Canada. People are experiencing financial pressure and may be less able or unable to pay regular bills, such as mortgages, insurance, or power bills, or taking on more debt. Stress and worry is normal in normal life. This certainly is not normal life as we've known it. With so few cases here, we can certainly take some comfort, knowing that the steps we took and continue to take are paying off by protecting the lives of our most vulnerable. But the other side of the equation has taken its toll. It is very hard, however, to continue to feel thankful for the relatively safe situation we are in, while faced with the challenging reality of the issues I've just discussed. Last week I talked a bit about unintended consequences and the concerns I have about the health and wellness of all Yukoners. I know many people who have come through all kinds of hardship, and many who have supported others through their whole lives. Some of these people might think that having a mental health difficulty is a sign of weakness. I want them and their families to be reminded that it is not a sign of weakness to admit that you're struggling. It's a sign of courage to stand and ask for help. Help that can look like a counselor, or reaching out to a friend, or talking to your family doctor or community health nurse. We know across Canada that people are struggling with their mental health. Statistics Canada reports that there have been drops across the whole country in how people see their mental health. From the young to the old, people are reporting worse mental health in 2020 than in previous years. I hear from my physician colleagues that their patients are stressed and the ongoing uncertainty is taking its toll. And to recap from local data, we're seeing more overdoses, more cases of alcohol intoxication, behavioral issues, emotional distress, while the RCMP are reporting an increase in assaults, including domestic assault, possession and trafficking, and there are calls for people in mental health distress. People who use drugs in Yukon have told us of their fears that an already unsafe supply has become even less predictable. I know that some may be using more at this time as a coping mechanism. So what is out there to help? Well, starting with opioid drugs, the Whitehorse-based opioid treatment services are available to anyone who feels a need to discuss or address their opioid use, especially considering these increased stressors that we're under because of COVID-19. And these services include support to rural health providers to look after rural clients with opioid use disorder. Opioid treatment includes access to prescription medications such as Suboxone and Methadone. If people are unsure if treatment is right for them, they can still come in and have a conversation with a clinician about what options are available. Today we're providing a comprehensive list of all mental health services and supports available to Yukoners. And this list is being provided to physicians, to allied health professionals, non-government services and others, as well as being posted to the COVID-19 information pages. Maybe it's a long time since you've seen a counselor, and maybe you've never reached out for help before. And that's okay. There must be a first time for everyone. And maybe you don't even know where to start. But someone is ready to take this step with you, so you won't be alone on this journey. Reach out to someone you trust. You'll be surprised how much easier everything is to carry. In times of crisis, many turn to their faith, and during this pandemic, they have been unable to gather in person or even visit a place of worship. This can and has created further angst for some. I am pleased, as Minister Streicker has announced, that beginning this Sunday, places of worship will be permitted to reopen. Earlier this week, I hosted a conference call with Yukon faith leaders and was able to provide the written guidance as well as answer questions around reopening. Maybe the key takeaway from this is that service organizers and attendees are required to adopt steps to ensure physical distancing and adapting the nature of services where necessary. The guidance for faith-based services and activities is now posted online. And this return to services, whether faith-based or limited gatherings or restaurants and personal services, all will contribute to increase mental wellness as our communities take steps towards a new normal. And now, another important rituals for Yukoners to bring back. Yesterday, I was flagged downtown by someone who said, "What about garage sales? Can't we go ahead?" And I thought, why shouldn't we? We have been cautioning against garage sales this year because of the potential they pose for transmission of disease. But given where we are, that with a few extra precautions in place, we can advise that this rite of Yukon summer can go ahead. Our recommendations are that individuals holding the sale set them up outside, spread out goods to allow ample space for physical distancing. Clean items before setup, sanitize surfaces regularly throughout the sale. Wash your hands after each cash transaction, or wear gloves. If you are a shopper, observe 2 meters physical distancing while garage shopping. Shop with your eyes and avoid touching items whenever possible, unless you make the decision to buy. Wash goods when you get them home, and wash or sanitize your hands after visiting a sale. Just like everything else, if the guidelines are followed, then we continue to enjoy the activities we love. While talking about mental health and stress and ritual and garage sales, I've hardly mentioned the Safe Six. Minister Streicker enunciated them very well just now, but let's say I'm also saving this most important part for last. We are reopening steadily, and we're already looking forward to Phase 2 and Phase 3 beyond that. Phase 2 means the BC bubble will open and further lightening of border restrictions will occur, as promised, with Phase 3. Each easing of border restrictions means taking on a necessary degree of added risk of COVID importation. a low and manageable risk based on importation risk estimates, but nevertheless a real one that requires careful and persistent adherence to public health measures, including the Safe Six. Practicing the Safe Six now keeps us safe and will carry us through the months to come. We have been in a bubble of protection, but we cannot sustain remaining in a bubble of COVID-free privilege. That is a false protection, as we know well the consequences of being too shut down for too long. Our first tool has been the hammer of border closure. Our tools for the future are much more sophisticated, require practice and continual retraining, but they will keep us healthy in a much more balanced way. I just want to come back to the bird before I end. With a little bit of imagination and teamwork, we managed to help it find its way out of the maze of cubicles to freedom. As I watched it fly towards the light of a beautiful Yukon evening the other night, I was able to feel hope for all of us as well. I wondered at all the other tools of the trade that this little creature's plight demonstrated. Innovation, compassion, kindness, camaraderie, and teamwork among them. To say nothing of some careful cleanup afterward. If you can, I encourage you to take some time today to reflect on what brings you hope and see if you can share that as well. You never know whose day you might brighten just when they need it most. And that's all for my update. Thank you.
Thank you, Minister Streicker. Thank you, Dr. Hanley. We'll now go to the phone lines. Gord, Yukon News.
Today of the three territories could possibly not be united now due to potentially welcoming BC residents as a phase 2. Was wondering what the Yukon government's response is to that.
Do you want me to start?
Sure.
Sure. First of all, thank you for the question. Thank you for the question, Gord. I missed the very beginning of it, but I think you're asking about the bubble with BC that we're thinking of in July 1st and the response from the other territories. First of all, I know that Premier Silver has been in close contact with Premier Cochrane and Premier Sakovic. I think we continue to have conversations with the other territories. You need to understand that the choices that we will make as a territory here are not necessarily dependent on working in lockstep. We can, for example, welcome NWT residents to come into the Yukon. That can be our choice, and we don't necessarily expect that it would be reciprocated. It may be, but it does not need to be. I think that we are making our choices based on the advice from the Chief Medical Officer of Health, and he can speak to his perspective, but the way I've had it explained to me and how when we're in conversation with other jurisdictions, it's all about the epidemiology and nothing about the geography. It's about the risk and how that risk is relative to the situation in hand. So I appreciate that the other territories may change their mind, and of course we're all working to transition over time. So I think that the question is still on the table. I know that Premier Silver will continue to be in that dialogue, and we'll continue to hear the best advice, medical advice that we have from Dr. Hanley and his team.
Thanks. Yeah. I would agree. I would just add a couple of things. One is, geography is part of the equation. It's just that it's not the only thing, because we again have a very special relationship, as I talked about last week, with BC, including a quasi integration in many of our public health areas, and certainly daily conversations, and so we feel, in addition to the fact that we share a border, that the COVID situation is under such great control in BC, and because we're talking about a province of several million people, that it really makes a lot of sense. And we're very comfortable with the risk assessment to date. We would also be very comfortable with a northern bubble. I guess we were rejected for now from the triumvirate due to the fact that we had opened up, or we were planning opening up to BC. So the risk assessment from the other territories was such that they felt that they this time did not want to include us. So it's as Minister Streicker said, it's not necessarily perhaps we can enter some other arrangement that is asymmetrical or not reciprocal. So I think we can still talk and work away on this on this question as well.
A question, Gord?
With the respiratory center essentially being transferred to YCDC, any update on how that's going? Yes.
Thanks for that question. So one thing I want to clarify is YCDC, that's Yukon Communicable Disease Control, has always been seeing the majority of people for testing. And the focus for YCDC has been on people when they screen in through the 811 call or through the self-assessment for a conversation with YCDC. The ones who are higher risk, people who are at higher risk because of a travel history and symptoms, or because of contact with COVID, are the ones where YCDC and or community nursing, if it's in a rural community, that's where we really want the focus for YCDC to remain. There are other people who may be assessed as lower risk that would normally be that would have been assessed at the Respiratory Assessment Center, a much lower volume, and this had, as we had said, really come down to a trickle of people, and so these are people that would now be recommended to be assessed either in health centers or physician clinics or the emergency department, and so we are working with the physicians as they're starting to restore in-person care, to be able to accommodate people for testing within clinics. That's going to depend on the clinic and where they are in that restoring of care. But that is a process that we're working through. In the meantime, patients who need medical assessment will be referred to the emergency department, and people who are not otherwise flagged as higher risk from a public health point of view will also be referred to the emergency department. We're still seeing, again, because of where we are in terms of overall respiratory illness in the territory, it's very low numbers. We're continuing to see overall quite low numbers of people going for testing.
Thank you. We'll move now to John, CKRW.
Hi. I've heard that there has been some delays in getting rent program assistance money out to tenants. I was wondering if maybe the minister could address that.
Thank you. I hadn't heard that, John. I'm happy to try and follow up. I know that the program isn't being run through my departments. We were the group that had brought in the rules to protect tenants and to help tenants if they were in disputes with their landlords to navigate questions like that. But I'll be sure to try and follow up. I know that someone said to me the other day that there's so much information on the website now. I think there's been a lot of programs that have been put out there, and I think it's important that we continue to try and follow up to help people navigate. So thank you very much for the heads up, and I'll make sure to follow up.
Question, John?
I have to cede my question to the other journalist.
Thank you. We'll move now to Chris at CBC.
I guess I'm just curious how much, given that BC is a market of 5 million people and the Northwest Territories is not, how much economic factors played into the decision to open travel with BC?
Do you want to start?
I can start. So that's definitely a consideration, and I did hear from some members of the business community that was really important. That if we could salvage anything of some of the economies, especially the ones that are hurting more, the ones that depend on visitors and the ones that depend on tourism, that they really wanted a chance for a safe domestic border opening. And I want to say it wasn't a matter of sort of choosing one over the other. It was, as I said, the ideal would be to for me to have border openings across the north as well as with BC. BC, of course, it did not involve, although it involved several conversations. It's not a reciprocal arrangement, as BC's borders were already open to us. So it's a relatively simple matter for us. So it made it did make some economic sense. I know it's for many it's a kind of a drop in the bucket, but for me it was also a matter of families being able to visit, Yukoners being able to get out of territory for those who had the means or connections or the desire, and of course it for all the reasons I've said before, because of our public health connections, it made a lot of sense from the public health point of view. We know we have to move to open borders, and this to me is a really good way to begin.
If I can just add on top of that, sorry, I'm not sure if my mic's coming up. If I can just add on top of that for Chris, am I being picked up?
Yeah, I think so.
Okay, thank you. Sorry.
Hello?
Sorry, Chris. I'll just add to that response. What I wanted to say was that we've been working very closely with British Columbia. For example, when we first put in place our border restrictions, we spoke with the counterparts in British Columbia to Minister Farnworth to make sure that communities like Atlin were supported. Sorry, I'm just going to give you 1 second.
Just bear with us 1 second, folks.
Test. Test. There I am. Hi. Hi, Chris. I'll just add a small note on top of Dr. Hanley's response to your question. Since the pandemic started and we declared the state of emergency, I've been in pretty close contact with my counterparts from British Columbia. For example, when we first put in place border restrictions, we noted that some communities like Atlin and Lower Post would be effectively cut off if we didn't work together. So we've had an ongoing relationship with British Columbia. I know that, as I mentioned in my previous response, Premier Silver has been in touch with Premier Horgan, and I think that there is a lot of consideration that's put into this question. I mean, we rely very heavily on Dr. Hanley to give us a sense of what he believes the risk to be from a health perspective, and then we look at it from a logistics perspective as well. So I think that it's that economics come into it, but I don't think we could get there unless the health perspective was sufficiently safe in order to allow us to adjust the borders so that risk could be mitigated.
Thank you. Follow up, Chris?
Yeah, I guess so. The flip side of that is we keep saying that it's the epidemiology that will sort of guide these decisions. I guess what do you have to do, or what do you need to know from the MWT to allow Northwest Territories residents to come into the Yukon, and when will you be making a decision about that?
Well, I'll just start, and then I'll let Dr. Hanley talk about the health side. First of all, to be clear, we're letting NWT folks in through the territory now. So just, and I'm not trying to split hairs here, but they do come through. We do give them a map and ask them to stay on that travel route and to make their way to the NWT directly. So we've never closed the door to folks from NWT. I think probably the way you're posing the question, it means more whether they could come in without any restrictions. And I'll turn that over to Dr. Hanley.
Yeah, so it would, in terms of my comfort level from a public health point of view, as I said, I would be very comfortable with that arrangement. It ultimately becomes, again, a government decision. But again, it may not be a reciprocal decision given what is some apparent discomfort from NWT. But from my point of view, I would support that.
Thank you. We'll move now to Gabrielle, Whitehorse Star.
Hi, I'm wondering, just to kind of follow up on what you said about how it may not be a reciprocal decision, does that mean that if it is an asymmetrical agreement and people can move from NWT freely into the Yukon, does NWT not have to agree to that?
No, I'll start. First of all, a lot of this we're speculating, and I just want to be careful here. I've heard Dr. Hanley say today here that he's comfortable with the health risk. I think then Premier Silver will continue to have conversations with Premier Cochrane, but it could be, for example, that like the relationship with British Columbia has been asymmetrical. Right? We've asked when people come from British Columbia and ask today that when they come in, that if they're coming for essential services, that we ask that they isolate for 14 days. The same is not true when Yukoners head to British Columbia. No one is sitting there on the BC side of the border saying, hey, when you come in, you need to isolate for 14 days. So that's asymmetrical. It could be that way, of course, with the Northwest Territories as well, where if based on the advice from Dr. Hanley that the health risks were low, and when we get into phase 2, we could say, if you're coming from the Northwest Territories, we will allow you to come in and we won't require you to self-isolate for 14 days. Does NWT need to reciprocate to make that happen? No, but I think for now, we heard clearly from the Northwest Territories and Nunavut that they don't feel as comfortable about British Columbia. I think what will happen between now and July 1st is that our Premier and us as ministers with our counterparts will continue in that dialogue. A lot can happen, as we all know, within 1 month. My goodness, just look how much has happened from the start of canceling the Arctic Winter Games to the subsequent months. So I think that we've just heard from our neighbors, and I'm sure we're going to continue to work with them.
Next question, Gabrielle.
Yeah, I was wondering, just to go back to enforcement in regards to this being out-of-territory plates. I'm wondering if you can walk us through what happens if a complaint is filed, if somebody reports out-of-territory license plates. What happens with that information?
So what happens is if they call into the call center, there's a template that the call center folks follow where they collect information. Those people calling in can be anonymous or they can give their name. It's their choice. Then it goes to our enforcement team. We've drawn that team from folks all across the Yukon, conservation officers, natural resources officers, sheriffs, liquor inspectors, I'm missing someone, scan officers. So we've drawn from across a Yukon government staff, and they do an investigation. They may follow up with the person who's giving the information. It depends. But they'll go try to investigate to see. So let's say that someone sees some license plate that's come from somewhere, say, with U.S. plates. That information comes in. Then they go to follow up. Normally, or in the bulk of the cases, what happens is those people are doing the right thing, and it's just a matter of clarifying that they're here on essential work or they're here appropriately. If they're not, then the next thing that happens is those enforcement officers work to get compliance. They work to get correct whatever that situation is that they're uncovering. If the people, and that almost always happens. If the people are not, then they can issue a ticket, issue a charge, and we've seen that happen once here where it went to court. So and of course all of that is tracked in a central database, but we also are protecting people's privacy and information around that database. So that's sort of the sequence of events.
Thank you. We'll move now to Julien, Aurore Boréal.
Oui, bonjour, merci. Ma question est pour le Dr Hanley. Je me demandais en fait, c'est quoi les risques et les défis à prendre en compte quand on décide d'ouvrir la frontière avec une province comme la Colombie-Britannique qui a une population de 5 millions d'habitants?
So the question is for Dr. Hanley. What are the risks and challenges of opening the border for British Columbia with the difference in population from there to here?
Merci pour la question. Et c'est un risque qui est basé sur les données qu'on a, et pour la plupart c'est disponible pour la public de l'épidémiologie en Colombie-Britannique. Colombie-Britannique reste dans un très bon état, donc malgré le 5 millions d'habitants, il y a un taux de COVID qui est très très bas. En fait, si on compare risque par population, c'est dans le même domaine que nous. Donc, c'est un risque qu'on va continuer à suivre, évidemment, et en quelques semaines en plus, avec l'ouverture qui prend place à ce moment en Colombie-Britannique. On paye très proche attention à la situation MBC, et pour le moment, ça continue d'être dans un très bon état. Donc, le risque d'importation des cas à ce moment des résidents de Colombie-Britannique, c'est très bas. C'est jamais zéro. Il y a toujours un risque d'importation de COVID, et c'est dans la motif pour moi, c'est il faut apprendre à co-vivre avec COVID. Donc, il faut habituer à un risque toujours présent dans la population de COVID, et c'est pour ça que il faut continuer d'emphasiser, de constater les règles de les Secure Six, les Safe Six, les mesures sont très importantes de continuer.
Merci. Avez-vous une autre question, Julien?
Oui, merci. Plus tôt dans la conférence, M. Hanley, vous avez mentionné que vous étiez déjà en train de penser, ou du moins élaborer la troisième phase. Si on considère que la tendance est bonne et on garde le cap, c'est quand qu'on pourrait voir le Yukon entamer sa troisième phase?
So the question is for Dr. Hanley. You mentioned earlier that you're looking into phase 3, what it will contain and require. So when do you expect that we will see phase 3 coming in?
Ce sera peut-être méfiant de donner le date en français et pas en anglais, et on n'a pas encore prévu en date. On est juste en train de parler des dates possibles. Donc, et c'est le conseil que je vais discuter avec le premier. le Premier ministre. Donc, on va vous dire quand on est prêt. Donc, on n'a pas toujours pris une décision. C'est juste une question de examiner les options, les risques, les possibilités, et on va revenir avec la date quand on est prêt. Just to repeat in French, I said I'm not going to give away something in French that I wouldn't say in English. I'm not ready yet to give a date. That'll be the government's decision. We're starting to deliberate on some of the possibilities and some of the risks and some of the options, and we will be bringing that advice to government. And so in the weeks to come, we will be able to announce a projected date for phase 3.
We'll move now to Claudiane, Radio-Canada.
Oui, pour le docteur Hanley, donc mon collègue de l'aurore boréale vous a posé la question sur les risques. Je me demande si vous pouviez me reparler en français des facteurs qui sont pris en considération pour ouvrir la frontière avec une province ou un territoire. Vous avez parlé des considérations économiques, vous avez parlé beaucoup de santé mentale. Je ne sais pas si ça vient jouer aussi là-dedans.
So the question is for Dr. Hanley. You talked about the different challenges and things you will consider to opening the border with BC. We would like to hear more about the factors that you're going to take into account. You already talked about the economic factor and the low level of COVID in BC. So are there any other factors that you will be taking into account into opening these borders?
Merci. La situation entre nous et Colombie-Britannique est spéciale et c'est comme pour les raisons que j'ai expliquées, c'est une étape logique pour nous pour prendre en parlant de le jumelage, presque le jumelage qu'on a avec Colombie-Britannique par rapport aux santé publique. On participe régulièrement dans les réunions avec nos collègues dans la santé publique en Colombie-Britannique. On a beaucoup de programmes en commun. On est dans une position de partager l'information. Donc, on est très étroite et on n'a pas la même sorte de relation avec les autres provinces. On a sûrement une relation fraternelle avec les autres territoires et donc c'est naturel pour nous de contempler aussi un jumelage ou une combinaison, une ouverture en commun avec les autres territoires. Pour le reste du Canada, c'est pas encore élaboré par nous le procès d'ouverture des frontières au-delà de ce qu'on a déjà prévu avec Colombie-Britannique. Donc on est en train de faire l'analyse pour les prochaines étapes.
Minister Streicker?
Hi. I just wanted to add that I think it's important to note that Dr. Hanley, he will give us a recommendation, but it will be the government that will take the decision about whether or not to open the border. So I just want to make sure that the Yukon understands that the responsibility will lie with us ultimately, the government, in making that decision. C'est le gouvernement qui fait la décision pour ouvrir ou fermer le bord avec Colombie-Britannique, même les autres.
Et merci pour nous rappeler.
Thank you. Prochaine question, Claudiane?
Non, ça va, merci.
Merci. Thank you very much for your time today, Minister Streicker, Dr. Hanley. The next COVID-19 update will take place on Tuesday, June 9th at 2 p.m.